Dear friends, of course, this is a special moment for me opening this Congress. And we arrived in London a few days ago, and it is really a fantastic city. And we understood that climate is changing because we see Britain as a sunshining country. So, first of all, I have to say thank you to three people, to Claire, to Valerie, and to Andrew, for giving me the great honor to be here today for this opening lecture. And then I will focus, me and Vitske will focus on the key topic of this Congress. My topic will be the future of facial plastics. And it will not be about technique. There will be plenty of lectures, presentations, roundtable, instructional courses about techniques. But it will be around brainstorming. And it will not come only from books, from what I have read, but this is, let's say, kind of a resume of a long personal journey lasting almost 30 years in rhinoplasty. And I was fortunate enough to get a kind of fisheye perspective to look around at 180 degrees to this topic. Because, let's say, I had the pleasure and the honor to be an educator in our university in Varese in Italy. I had, let's say, the possibility to work at the highest level in several institutions, being the president of the International Federation of Facial Plastic Surgery Society and the European Academy of Facial Plastics. And then, of course, from the real life that really counts. I live and practice in Milan, Italy, which is a very competitive environment. 283 colleagues offering rhinoplasty in my city. And rhinoplasty is almost 100% of my practice. And by doing this, investing time, energy, efforts, well, I was able to create a unique rhinoplasty-only practice in Milan. So I have now 23 minutes to tell you my story about the future of facial plastics. There are two horns in this title. The first horn is the future. And I like this definition of the Devil's Dictionary. The future is the period of time in which all our affairs prosper, our friends are true, and our happiness is assured. And my perspective about the future of facial plastics is coming soon. And the second horn is facial plastics. And at the end, what is facial plastics? What is such a thing? Currently, I think that in preparing the lecture, I was thinking that maybe we can think about layers of facial plastics. And the three layers are the playground, second, the public, and third, the players. So the playground. We talk about, of course, reconstruction, but the field now is also about function and aesthetics. All this is facial plastics. But I think that in the current time, aesthetics is the key. May I have the volume, please? Because I don't have any volume, otherwise it will be a problem. Can you help, please? Thank you. So, the first point is surgical rejuvenation of the face. And this is clearly a key point. But what is increasing in this field is, the second point is the matter of injectables. And I think that especially for the younger generation, this is, let's say, a question that you should focus on. And of course, the key is aesthetic rhinoplasty. So when I see that aesthetics is the key, we all know why. And the why is that because there is money involved in, and the password is facial plastic surgery. And then we go to the public.
I had bad plastic surgery.
I think we can figure something out here. Relax. Relax. That's relaxed? Here, let me just pull it down for a sec. And I let go. Okay, shoots right back.
Oh my God!
What?
This is
Wow, that was high. That was high. You gotta watch that. It's gonna just get caught in your hair.
That's just...
Let me give you a hug. That's what you need first. All right, we'll fix this. We'll fix this.
Well, many times though, you need first as a hug and to reassure the patient. Well, actually, hashtag, I love my patients. And we all love our patients. But there is a big but. The big but is that they are different from the other patients. And they became different in the time of the internet, in the time where you can buy rhinoplasty for 90 euros monthly. This is on the internet. And they say that it can last 20 minutes, the operation. And you can buy on Groupon. And they became different in the time of selfies. It is really, for us, patients sending you through WhatsApp the pictures of every change in their nose. And in the time of this question, the narcissism in our society, which is invading any corner of our society, but especially in the time of millennials.
Amy, it says you are trained in technology. That's very good. Are you adept at Excel?
No.
PowerPoint?
No.
Exactly in what area of technology are you proficient?
Snapchat, Pinterest, Instagram, Vine, Twitter.
I'm surprised you didn't say Facebook.
That's for old people, like my parents.
So, you, I, all of us must be ready actually to understand that patients can turn into your worst enemies, and then we may have our darkest hour. And then the players. The players, it is really a very crowded arena. We have general plastic surgeons, ENTs, MaxFax, and cosmetics surgeons. The future is already interspecialties competition. Well, it is good. It is nice to have valid competitors. It pushes you to do better, which is good. And this interspecialty competition, when going to international conferences, has two phases. You talk with your colleagues, the plastic, and they are fair at meetings. But some spicy drops. When you come back home, competition is tough, is very tough on the domestic market. Who is moving my cheese? Another but here. Interspecialties competition, actually, we should see also on the other side, should see the other side of the moon. It is a great opportunity really to learn from differences. And I would like to focus on these aspects. Because in the last years, we have witnessed the birth of something. And this something is the crossing over of specialties. And I think that the European Academy deserves a big applause for having had the vision to see the future. And in 10 years, through the European Academy, now facial plastic is an officially ORL HNS subspecialty. Facial plastics is officially in the UEMS logbook. There are training centers in Europe, and there is a European board for certification in facial plastics. And now the players. And this last part of the presentation is dedicated to you. I see many young faces here, the juniors, who are going to download your future to create a practice in facial and nasal plastic surgery. Well, we are in London here, and I like very, very much the title that you gave to this meeting, Where Art and Science Meet. And if we think about this title, it can be about facial plastics. So, in London, something magic can happen. So, you see, I think that for some of you, something magic will happen during these days starting from today. And this magic is that you are here, most of you are rhinologists. And then some of you will want to escalate to go to rhinoplasty and then to facial plastics. And then you have to be aware that you have some bottlenecks to pass through. The first bottleneck is the passage from rhinology to rhinoplasty, and then second passage will be from rhinoplasty to facial plastics. For me, this second bottleneck is the easier one, because when you are established as a rhinoplasty surgeon, facial plastic is just the natural evolution of your rhinoplasty practice. And I like to remember the unforgettable Tony Bull. Once I had a note, he told, "He who has got the nose has got the face." But let's focus now on the first bottleneck. So here, when you want to focus just on this little organ, the nose on rhinoplasty, and it is a long road actually, but believe me, it is worth it. But before you start the journey,
dark and difficult times lie ahead. Soon we must all face the choice between what is right and what is easy.
well, this is the starting point. We are special profession, special for many reasons. If we do this choice, I'm sure that it will be your right choice, but it will not be an easy one. Facial plastics is a different thing. You have to change the profile, the knowledge, the skills, the mind, and the ethics. And I have two bullets of wisdom for you. The first one is that you have to change your profile. This when you want to go from here to there. I mean that you have to reposition and rebranding you, because we have to differentiate you from your competitors. And you have to say no. Remember, you don't be on the market as an ENT specialist otolaryngologist, or ENT. People, general public, does not understand this. 85% of the people, they do not know that otolaryngologists perform rhinoplasties. So the key word is plastic and plastic. And of course, you have to deserve them. And the second bullet of wisdom is that you have to acquire specific technical skills. For me, rhinoplasty, the most difficult part is analysis. Analysis comes first. And in rhinoplasty, always about analysis. Techniques are limitless. I am an endonasal rhinoplasty surgeon, but I am a better endonasal rhinoplasty surgeon because I mastered the open approach. I mastered everything about rhinoplasty. So the next slide is the most important of my presentation. Don't become the slave of one technique. The very first question when I see a patient is, how much surgery do I need? These are 3 primary cases of the last 3 months. Very modest problems. How much surgery do I need in them? And how much surgery do I need in them? I think that you and I agree that they need different amounts of surgery, and they need different approaches. So this is really a plea for minimalism. Don't overdo. Just 3 cases. He was a national team volley player, typical male nose. Beware about male rhinoplasty. It is a specific field. So we do not want to feminize a nose. We want to give a strong profile. We want to reshape the radix, the dorsum, the position of the nasal tip.
What?
Here and there. Well, actually, he became a top model for Dolce & Gabbana. You see that we have repositioned the bony base, repositioned the brow dome lines, the position of the nasal tip. This is the base view, the width of the bridge, the width of the bony base, the helicopter view, the side view. The tip remains there, the 3/4 view, the other side view, and then 3/4 view. His endonasal approach for easy cases only. That lady, she did already 3 rhinoplasties, 1 through an open approach.
What?
This is rebuilding the dorsum, derotating the nasal tip, the dorsum pre-op, the dorsum post-op, pre and post, 3/4 view, and then the impossible nose.
What?
The impossible nose is this, when you have to combine aesthetics and function and reconstruction. This is the base view, base radix view, helicopter view, side view. The ala was pushed down through a composite graft, the other side view. So the take-home message is that a rhinoplasty is an eye, brain, hand, heart operation. And then the last seal here in London is simplicity is the last stop of the genius. And thank you for your attention.